Everything Mental Health with your hosts, Stephen Edwards and Maureen Edwards.
Hi, Stephen.
Hi, Maureen. How's it going?
It's really good.
That's wonderful to hear. So I wanted to talk to you a little bit about set therapy, particularly psychotherapy, because I know that you've been doing that for a number of years now and have your own practice. And I'd like to talk a little bit about some of the benefits that you see when doing psychotherapy. And let's talk about specifically in children. Is there a specific age they should be to start? Is there a specific timeliness that they should be doing it? Maybe for 1 hour sessions, or is it better to be shorter sessions? Ultimately, I would just like to kind of hear a broad overview about your experience and some wisdom you can impart on some parents who might be thinking of letting their children start psychotherapy.
Yeah, I think it's a really good question. Sometimes you'll get a call like from a mother or a father saying that their child, they want to get them into therapy. And usually they're school age. Sometimes they're under the age of 5. When they're under the age of 5, it's quite difficult to engage like a little child in any kind of psychotherapy. So it ends up being play therapy. And play therapy might be drawing pictures. It might be playing with little rocks or stones or pebbles or marbles. It might be using colors. It could be listening to music. There's a lot of things you can do with a child that age. Usually, I would like to engage the mother's giving her input as to what she feels is the issue with the child. Sometimes I might want to see the mother and the child interact together. So we would have like a little family session, maybe even with the father if the father was available, and to see what the family dynamic is. And at that point, assessing if it's more of a learning, parenting tools that could happen with the parents, or if it's the whole family together, or if the child would benefit for some regulation tools and maybe just another ear to be able to talk to someone.
So you mentioned
Yeah.
that some of the ways that you can implement play therapy would be maybe drawing a picture or listening to music together, or, well, you named a few others. But can you flesh out what are you getting out of that? What is the child getting out of that? And you as the therapist, how are you using these little activities in a way that promotes growth, learning, and ultimately reaching the goals that mom and dad set out to achieve when they started therapy?
One of the first things as a therapist that you try to do is to connect with the child to develop that relationship. And many times that is through play and watching what the child is interested in and commenting on what the child is drawing or playing with. And sometimes it's a little bit of a narration of what the child is doing and asking questions as you're watching the child play, just so that you get sort of an input. A lot of times they'll just go into their little fantasy where this is, the man and he's doing this, and this is the dog and he's doing this, and they'll just tell the story of what's going on. When you do that, a lot of the times you can pick up an underlying emotional theme. Sometimes it's anger, sometimes it's frustration, sometimes it's dysregulation, like it's very hard for them to keep on track with one thing. They want to keep jumping around. And then you kind of go from there.
Very fascinating. Thank you.
Thank you.